So, I'm going to talk a little bit about the role of semantics and the ICT educational standards in developing IT skills for healthcare workforce. I think that's a reality now that we care a lot about being online, sharing information. So definitely we're living in the digital age. But at the same time, there are so many applications out there, so many programs, that definitely there is a digital Tower of Babel that most of the time the different applications cannot somehow communicate with each other. Just imagine how many passwords do you have. But is there a Tower of Babel in healthcare workforce training? If we consider the e-learning and standardization, which standards is one of the fields that could definitely help us to avoid this, building up this tower, and think that medical informatics already developed standards for the interoperability between applications. Develop terminologies, classifications, and the medical education community is not so active on doing that, with quite a few exceptions. Then definitely we need a lot more work to be done in order to create a nice field in the area of medical education informatics. So there are standards out there, and there are quite a lot. This is like an old picture back from 2009, and I'm more than sure that if we try to do the same picture now, it's going to be like twice as this one. But somehow we have to use the standards, and we have to find an effective way of using the standard. There are some European efforts. There are the European Qualification Framework and the European Incompetence Framework that both are trying in their field to establish a common language, a common way of communicating. But none of them is focusing directly in healthcare education. On the other side, there is a big effort from MedBigitus Consortium that has already some standards available and works towards the implementation of more standards that actually connected with each other. So they have a map, they have a world somehow that it can communicate. The current efforts in healthcare workforce training, if we would like to sum up, I would start with the collaboration between European Union and United States, because it's two of the most advanced competencies in digital, two of the most advanced societies in the digital age, without excluding anyone. They have signed a memorandum of understanding a few years ago, and one of their tasks was to map skills to professional roles and to introduce standards and to be used in health education. Another effort is coming from Association of Health Informatics of Medical Association of United States, that they developed a career map where the competencies of actually 55 different job titles can be found. There is also a really new initiative, the Global Health Workforce Development, which also tried to establish a global health information curricula and competency standards. And of course there is CAMEI. It's the project which sponsored this conference. which aims to bridge the gap in the same area as well. CAMEI, as we heard this morning from Panos, also is a 2 years project, and the 4 core partners of the project is the Northern Research Institute in Norway, the Aristotle University in Thessaloniki, Karolinska Institute in Sweden, and the Polytechnic University of Valencia in Spain. So CAMEI aims to bridge the gap in a lot of different areas, but definitely one of them is to set the ground based on ICT educational standards in order healthcare workforce education training to be built upon that. One of the actions of CAMEI, a result was a social semantic registry of IT skills for healthcare workforce. Wanted somehow to monitor and create the curricula after that in a global registry for healthcare workforce. Also, another output from CAMEI is a cooperation action plan, which as a base has the educational standards, and it is to be used between different partners in order to describe a prospect, a collaboration or a future collaboration. But trying to keep the time, I will go to if the semantic technologies are part of the game. I think this is a really a common picture that you all came across somehow, this one, or a little bit different. But while the technologies are coming and becoming more mature in the digital age, the semantic aspects are continuously increased. So definitely it's part of the game. Definitely we need descriptions in order to achieve semantic interoperability between different repositories of learning educational resources, or between people and and educational objects themselves. An area where we can find a lot of information, a lot of health information, health medical data, is the linked open data cloud. Actually, if we manage and semantify this information, we can get out really powerful outcomes like knowledge, health knowledge and medical knowledge for the healthcare workforce. Effort towards that direction comes from MEDucator project, which actually tries to link different registries of educational material in a smart way. So everybody can share their resources, but at the same time can get the resources from others. To this extent, the semantification of the open education resources themselves and the connections with other objects is part of the game. So, for example, if you have a YouTube health video described with an educational, with a standard, then you can get out of it some keywords, and based on that keywords, through the semantic web, you can get some additional material. Imagine that to happen in a bigger space, so those material at the end can be knowledge. Really to the end, we heard a little bit about medical learning analytics, which is a new field, and definitely it will allow us to establish best practices in updating students' interaction quality by optimizing learning in medicine and health sciences and fostering those activities that achieve clinical competency. So I will close with this image, trying to give a message that standards are here, semantic technology are here, but we still need a lot of collaborative work to do the job. So that was. So thank you.
Sorry, I forgot. I was interested that you're linking various data repositories together of learning objects. How easy are you finding it to retrieve across a range of repositories?
It's not so difficult. Once you have the descriptions of all the resources there, I mean, all the information is there. The work has been done. Currently, there are a lot of mainly computer science researchers that are doing research on retrieving information, knowledge on big data sets. So the most difficult part is to get the data out there, to retrieve the knowledge out of them. I believe there are a lot of really fast algorithms that can do the job and get you what exactly you need.
Oh, thank you. Is there any other questions?
Okay.
Vicente?
Congratulations for the presentation. Stathis, more than a question, it's a comment relating the last slide of your presentation about the work still to be done, because tomorrow we will organize a workshop where, I mean, starting from this point, we are already inviting all of you, because we are still collecting new ideas, and we would like to have also your thoughts about it, because I mean we have still the chance to influence the policies of the European Commission. So even most of the work in CAMEI has been already done, we have still this chance. So I mean, Stathis is fully aware of that, but this is an invitation for all of you. Please stay tomorrow till the end of the workshop, because you have the chance to influence in the policies of the European Commission in education in medical informatics, and that's a big challenge. Thank you.
Thank you, Vicente. So if you want to influence the European Commission, you have to be here tomorrow at the last session.
Are there any other questions? I'd just like to ask one more that follows on from my first question, and that is, do you find that people are coding the metadata in similar ways, so that when you start searching for something, what you're expecting to get is what you actually retrieve, or do we need to do some work on getting comparable coding across the different repositories?
If I understand correctly the questions, you mean paper coding the resources that we have?
Yes.
In order to find the information, all the information has to be digital. Otherwise, it's going to be really difficult to identify this information. If we manage to code the metadata, the description of the paper object, it's another way of doing that, but at the end we will not have access to the educational object itself, but at least we will know that exists.
Okay, that's lovely. If there's no more questions, I'd like to thank Stathis very much. Thank you.